Every one of us has been in a place in our lives where we wish that our bodies were different or could use some improvements. But most people are more entwined with their bodies than others. Some people are so obsessed with their body being perfect, it tends to interfere with their everyday life and cause some extreme emotional distress. That individual is suffering from body dysmorphic disorder or body image. According to the peer-reviewed article, Appearance Comparison in Individual with Body Dysmorphic Disorder and Controls, body image is characterized by distorted perception of appearance. People with this disorder tend to compare specific features of their appearance with others, rate themselves as being less attractive or ugly, and feeling less satisfied with their appearance. However, other people do not see what they see, but the individuals who suffer from the illness sees differently when they look into the mirror. Our textbook, Human Behavior in the Social Environment, gives an explanation of a fundamental tenet of ecological theory, which is originally developed by psychologist Yuri Brownford-Brand in 1979. The theory explains human development by arguing that people are diligently involved in their environments, and the way people perceive their environments and experiences significantly affects their well-being. People are influenced by the events that they go through and deals with circumstances in different ways. One individual may become depressed after a downturn, while another individual will take that downturn and turn it into a positive situation. The ecological theory displays four environmental factors at each level and their interactions with one another. The first one is microsystem, which consists of all roles and relationships that a person has to face contact with another individual in their environment, such as their home life, school, place of employment, and their environment. The second one is mesosystem, which consists of multiple interactions that impact an individual and their environment that they belong to. For example, when a person brings home tension from work, they tend to take the frustration out on their surroundings. The third one is exosystem, which consists of the reaction that take place in the social settings. Their interactions will impact the person directly or indirectly. So not only are people who have body image disorder affecting themselves, but they are also affecting people around them. These individuals tend to lose friends, significant others, and cause distress in their social settings. And the last one, macro system, which consists of ways of how larger cultural factors issues affect a person's behavior and development of their cultural beliefs.
Shalondria presenting on demographics and biological factors. Negative body image or body dissatisfaction is a subjective evaluation of one's appearance. Demographically speaking, body image affects young and middle-aged adults of both sexes across all ethnicities. Age plays an important role in body dissatisfaction. Young adults struggle with self-esteem and body image as they move from one phase of their lives to the other. As early as childhood, females and males are exposed to unrealistic body image ideals that may threaten their sense of well-being. A 10-year longitudinal study conducted by Quick indicates that demographics, family environment, peer environment, as well as psychological factors all contribute to body image concerns or body dissatisfaction in young adults. Most middle-aged adults experience a number of changes during their lifetime. Divorce, death of a loved one, menopause, increased weight gain, lowered activity levels, and so much more, which can all attribute to the lack of physical attractiveness. Women tend to have greater concerns for body image than men. 80% of middle-aged women report being dissatisfied with their body, weight, or appearance. Men appear to be less inclined than women to report holding negative attitudes towards their bodies, but do report a strong motivation to improve the appearance of their bodies. Poor male body image has been associated with a number of negative consequences for men, such as eating pathology, excessive exercise, steroid use, depression, and low self-esteem. Several studies have shown that young and middle-aged women experience the same level of body dissatisfaction across their lifespan compared to men. A study by Quick suggests that some racial or ethnic groups may be at greater risk for body dissatisfaction. Groups least at risk were African American. African American black women were most likely to describe liking everything about their bodies than European or white or Asian American or Asian women. White men have been found to be more dissatisfied with their body size or weight than black men. Some research suggests that non-white groups may respond differently to mainstream beauty standards through social comparison processes. Social comparison means that we as humans govern both our personal and social worth by how we measure up to others. This is done not only by comparing physical attractiveness, but also success, wealth, and intelligence. There are a number of biological factors that attribute to body image. Self-concept is the picture that we have of ourselves. Poor body image or body dissatisfaction can impact an individual's quality of life. Middle-aged men are considered distinguished and more attractive as they age compared to women. Race plays its own role in body image. A study conducted by Northrop shows that white participants that were exposed to skinny or overweight models, satisfaction with their bodies appeared to be low, and participants often felt bad about themselves, especially when the model was skinny. The results were different when black participants were involved. Different ideals exist for whites as compared to black people. Northrop points out that blacks typically lean towards the larger than the skinnier model. Disease or illness is a contributor to body image dissatisfaction. Middle-aged adults suffer from illnesses as they age. Young adults can also carry disease, which can affect the way that they view their body image. Breast cancer is discussed by Hidari. Treatment methods such as a mastectomy on patients include adverse effects on mental health, changes body esteem. Hidari study indicates that 44% of adults had a low body esteem due to cancer. Persons living with HIV struggle with body image as well. Young and middle adults have to face premature aging and body changes as a result of the illness. Lipodystrophy is one of the major concerns as it relates to disease. Lipodystrophy is the abnormal distribution of body fat.
Individuals who suffer from body image can struggle with depression, self-esteem, anxiety, high level of stress, social phobia, suicidal thoughts, and internal conflict as a result of their imperfection appearance. Most people compare body image with OCD because both disorder deals with an obsessive belief to do and feel a certain way. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders state 4 diagnostic factors of a body image disorder. The factors expand on individuals who suffer from physical appearance obsessions that are unknown to the eyes of others. These factors include behaviors from individuals partaking in repetitive behaviors and responses in a mental demeanor. Individuals' behavior may lead to an eating disorder and have a hard time functioning in their daily life. Individuals with body image disorder personality tend to be more introverted than individuals who do not. These individuals are less open to experience new things and very hostile towards people in their social environments. Most therapists treat these patients with psychotherapy, like cognitive behavior therapy. Cognitive therapy helps with multiple disorders and depression. The therapy will help patients think about what is more important in life and not focus too much on things that are unhelpful in their thinking process.
Various cultures have specific standards and norms for what is considered acceptable or appropriate concerning body size and shape. Body image tends to have a vast effect on how children perceive their body. Despite a cultural celebration of a fuller or leaner shape, a child can still be unhappy with his or her body. Due to the overwhelming expectations of what is considered the perfect body type, it can be difficult to be satisfied within one's own body. Young men often view the attainment of a muscular body as having reached the status of becoming a man. However, body image is largely focused on throughout girls and young women who oftentimes view the ideal body as ultra thin and a size close to 0. Society has contributed to many of these unrealistic expectations. Starting at an early age, traditional views are illustrated in childhood stories, movies, and television shows. As adults, the expectations continue with music, advertising, and literature reiterating the perfect body. When focusing on body image, most researchers find the most popular subjects to be on the African American and Caucasian cultures. While most African Americans tend to portray or desire voluptuous, curvier body types, which is seen as an asset within the culture, focusing in on breast and buttock size, which in turn is accepted and confirmed by African American men. Body image is more flexible within the culture versus the Caucasian culture, where the majority are portrayed or desired to be thin or size 0 body type, and curves or voluptuousness is seen as a negative. In the African American culture today, genres of music such as hip hop and some R&B is the common factor that influences how body image is viewed through the explicit lyrics and music videos that feature women with curvaceous figures and men with muscular athletic physiques. In contrast, where models and actresses tend to be the major influence within the Caucasian culture, portrayed as lean or petite with slim body builds. When assisting a client with concerns of body image, the social worker would likely focus on the individual's culture and what is considered acceptable within the culture. Seeking resources that assist in focusing on self-esteem could be one positive contribution to starting the client and focusing on individual body image.
Family influences on body image. Family and home life can have a great influence on a child's life. Families are the primary influence in adolescents' lives. They teach them what is socially acceptable or normal and what is beauty, essentially shaping a person's perspective on their own body image. The methods of influence can be direct or indirect. Direct influences include comments, teasing, and direct encouragement. An indirect influence is modeling actions. Negative communication regarding body image from family members, including critical comments, teasing, and encouragement to diet, have been associated with the development of body image dissatisfaction and eating disorder symptomology. Comments centered on body image can be positive or negative and can be described as any statement focused on the body, weight, and eating habits. These direct comments can be potent influences. According to Cluck, comments intended to be positive can cause negative body image. Teasing is comparable to a comment, but is different because the intent of teasing is to make fun of. Newmark and Steinzer reported that teasing is common among families and that in none of the reported instances in the study resulted with better outcomes as it concerns to body image. Parents can pass down their body dissatisfaction through comments about their own weight, which means that body image dissatisfaction can be generational. Ethical complications and concerns. Cosmetic surgery is an ethical concern when it comes to body image and the development of body image dissatisfaction. According to Sharan and McGee, body image may motivate many self-improvement behaviors, including dieting, exercise, and plastic surgery. Adolescents from ages 13 to 19 take fatal risks in order to improve their body image and self-esteem. Many teens are experiencing serious complications and even death because their body is not fully developed for cosmetic surgery. Ethically, is it right to perform serious cosmetic surgeries on preteens and teenagers?
As aspiring social workers, we must be able to assist clients on all levels, such as biological, psychological, cultural, family factors, and social factors that may have a body image disorder, and be able to assist to their needs in a respectable manner. Anything can decrease a person with body dysmorphic disorder self-esteem and lead them to lifelong complications such as eating disorders, depression, and suicide.